Hi everyone. I chose to do case study 5.1, a case of preeclampsia. Preeclampsia is a syndrome that occurs in pregnant women that can essentially affect all maternal organs by physiological changes such as onset of hypertension, blood clots, excessive oxidative stress, inflammation, and more. This case features a 19-year-old woman, Susan, who refers to herself as a meat and potatoes type eater who rarely consumes fruits, vegetables, and dairy products. Her diet is high in fat and sugar and low in fiber, as well as vitamins and minerals. At week 18, she was found to have proteinuria, and by week 22, she had high blood pressure and was diagnosed with preeclampsia. Additionally, she had insulin resistance and was overweight. Her baby was 5 pounds 5 ounces and was delivered by C-section at week 36. So, the first question asks, list 3 ways in which Susan's dietary intake likely contributes to oxidative stress. Oxidative stress and lack of adequate amounts of antioxidants plays an important role in the development of preeclampsia. Vitamin E and vitamin C are 2 very important antioxidants that are needed to keep oxidative stress relatively low. Susan does not seem to consume many sources of antioxidants in her diet, particularly vitamin E or vitamin C. They did mention that Susan will eat the occasional orange. However, that's not nearly enough to reach the recommended intake of daily antioxidants. Susan's foods that Susan could incorporate to reduce oxidative stress include almonds, leafy green vegetables, red bell peppers, and blueberries, amongst others. Another aspect of Susan's diet that is contributing to her high levels of oxidative stress is the high-fat meats. Susan mentions being a meat and potatoes type eater. Consuming high-fat meats can contribute to high triglycerides and cholesterol levels, increased risk of hypertension, increased caloric intake and weight gain, all of which affect risk and severity of preeclampsia. A third aspect of Susan's diet that contributes to her oxidative stress is the fact that her diet is very low fiber. The adequate amount of fiber intake is 28 grams daily. Susan mentions that she rarely consumes vegetables, and when she does, they are monosyllabic vegetables like beans, corn, and peas. These vegetables tend to be higher in carbs and starch than the dark leafy greens and are lower in fiber typically. The second question asks us to identify 2 other characteristics of Susan's diet that are contraindicated for women with preeclampsia. Answers should be different than those for question 1. First, Susan's high sugar diet is contraindicated for women with preeclampsia. Susan was shown to be insulin resistant, and the high sugar, which is mainly coming from the chocolate milk and the sweetened iced tea, could be affecting that and making it worse. Additionally, the fruits and vegetables that Susan does consume, like bananas, oranges, and corn, tend to be on the high sugar, high glycemic side of the fruit and vegetable spectrum. The second aspect of Susan's diet that is contraindicated for women with preeclampsia is her limited fruit and vegetable intake. The limited vegetable intake, combined with Susan not complying to her doctor's recommendations and not taking the multivitamin and prenatal vitamins regularly, could lead to a deficiency in many vital vitamins and minerals like calcium and vitamin D. The third question asks us to list 3 health problems that Susan could be at risk of developing due to her history of preeclampsia. First, Susan has doubled her risk of developing cardiovascular disease within the next 5 to 15 years. Second, Susan has an increased risk of developing both gestational diabetes and type 2 diabetes later in life. Third, Susan has increased her risk of developing hypertension later in life.